Namaskar dosto, good evening friends. I am Dr. Sanjay Kalra, your friendly and familiar endocrinologist, and you're watching Dr. KK's Med Talks, Mondays with Sanjay Kalra. आज के हमारे नॉन स्टॉप शो का 996वां 996th एपिसोड है. Let's have the headlines for today. Heat and heat. यही headlines हैं आज की. There's a heat wave going on across peninsular India, and temperatures have crossed 45 degrees in some places, 40 degrees in many places. Because of the heat wave, people are experiencing a high incidence of heat exhaustion, and many people have fallen ill because of heat in many states like Odisha and Karnataka. Experts say that global warming is going to worsen because of climate change, and because of that, the chances of getting heat-associated illnesses is going to go up. Not only that, newer diseases are being uncovered. Nephropathy, for example, means kidney disease, and heat-associated nephropathy, heat-associated renal failure, has been reported in Andhra Pradesh as well as in Sri Lanka. This means that जो हमारे kidneys हैं, वो directly heat की वजह से बीमार हो सकते हैं. With these headlines, let's go to our topic for today. देखते हैं आज का topic क्या है हमारा. A very apt topic, the heat wave and human health. अब अगर हमने heat wave and human health समझनी है, तो first we need to learn what heat is. ये physics का word है या weather का है, meteorology का है. ये चीज सीखने के लिए let's welcome our guest, an expert who has made India proud across the world. एक एक्सपर्ट जिन्होंने इतना कुछ कंट्रीब्यूट किया है हमारी कंट्री को और हमारी साइंस को, हम उनकी शुक्रगुजारी भी कैसे करें. The words are we'll finally have to end up in Haryanvi only with थारा भला हो and सबका भला हो. Warm welcome to Mr. S.C. Bhavan. Warm welcome, sir. अभी म्यूट है सर, but while sir joins, namaskar sir.
Yeah, thank you very much, Doctor.
Mr. Sir, we'll just introduce you. Mr. S.C. Bhavan is a retired Additional Director General and Scientist G grade of the IMD, which is India Meteorology Department. And he joined IMD in the year 1990 as a meteorologist. When he retired, he was heading 3 divisions: Agricultural Meteorology Division, Hydrometeorology. इन सब के मुझे definitions भी नहीं पता, सर को ही पूछते हैं हाइड्रोमीटरोलॉजी क्या होता है, पावर हेल्थ एंड ट्रांसपोर्ट सेक्टर एप्लीकेशंस एंड सोशल मीडिया. जो सर की लिस्ट है पब्लिकेशंस की, वो तो मतलब पूरी क्लाइमेट वार्मिंग जैसे जितनी तेजी से ऊपर जा रही है, ऐसे सर की लिस्ट है उतनी लंबी है. एंड ही हैज बीन एसोसिएटेड विद द हीट हेल्थ अर्ली वार्निंग सिस्टम ऑफ IMD since its inception in 2015, and he has worked for the WHO as well as for South Asian steering committees and for our National Disaster Management Authority. Warm welcome, sir.
Thank you, Dr. Kalra, for a very generous introduction, and very good evening to all of present from India or this part of the world, and good morning, good afternoon for those joining for other parts of the world. I first and foremost thanks AIMS Batinda, Dr. Sanjay Kalra, for giving me this opportunity to speak to the medical people regarding heat wave management in the country. We really would be speaking less on medical aspects because I suppose many of the experts joining today belong to that field, know much more than me. So I'll introduce why is it becoming important, heat waves, how a management system has evolved in the country, and this is one of the success stories of the country, recognized world over. The management of heat waves, it's a great public health contribution made by India, and many countries have taken inspiration from our planning and have put such a system in place, particularly the developing countries. Developed countries had heat action plans earlier than us. It started somewhere in 1995 with Chicago heat wave. We'll come to that and see how the system is being put in place, how various government agencies have come up with various protocols, and what impacts has it led to. So if Dr. Kalra, if you permit, can I start the presentation?
सर्टेनली सर, एंड आपको गुड इवनिंग आ रही है अरुणा त्यागी मैडम से एंड डॉक्टर रमेश पाल सिंह पवार सर से। दोनों रिक्वेस्ट कर रहे हैं सर, इंग्लिश एंड हिंदी बोथ, जब आप
Okay,
स्लाइड्स
I'll
अपनी।
mix in English and Hindi.
सर,
Share screen.
Dr. Shubhlata Chitwal madam has also joined from Delhi. Madam senior physician है, and we all agree, Dr. Pawar sir, Dr. Chitwal madam, कि ओपीडी में भी हीट एग्जॉशन, हीट रिलेटेड डिजीज बहुत आती है। हम बच्चों को, बुजुर्गों को, यंग लोगों को भेजते हैं काम पे, एंड व्हेन दे कम बैक दे आर सो टायर्ड। टीचर्स कंप्लेन करते हैं कि बच्चे पढ़ाई नहीं कर पाते स्कूल में। बुजुर्ग लोग कहते हैं कि जी कच्चा होता है, चक्कर आते हैं, याददाश्त भी कम हो जाती है, एंड इन द फैक्ट्रीज एंड इन द ऑफिसेज प्रोडक्टिविटी गोज डाउन बिकॉज ऑफ हीट। सो जो मिस्टर मिस्टर भान सर हमें जो पढ़ाएंगे, बताएंगे, दैट विल हेल्प अस फर्स्ट ऑफ ऑल अंडरस्टैंड हीट वेव एट अ मैक्रो लेवल, एट अ लार्ज लेवल। उसके बाद जब हम ये समझ पाएंगे तो ऑटोमेटिकली हमें समझ आ जाएगा कि मीजो और माइक्रो लेवल पे हम क्या क्या कर सकते हैं।
Is the presentation visible, Daksha?
नहीं सर, अभी नहीं। वी हैव फराज विद अस बैक स्टेज। फराज, कैन यू कम ऑन स्टेज एंड हेल्प सर?
You are sharing
अब आने
another
वाली,
page.
यस अब आ गई सर, परफेक्ट।
अभी आ गया, चल
तो
ठीक है
बस
Daksha.
स्लाइड शो में करना है।
It is in slideshow. I hope you are viewing it in slideshow.
अभी
And is it moving?
नहीं सर, स्लाइड शो वाला एक क्लिक करना रह गया।
Slideshow में ही किया था. Okay, I'll exit it.
मूव तो हो रहा है, फर्स्ट वाली आ गई आपकी, हीट वेव्स क्लाइमेटोलॉजी।
Is it in slideshow now?
नहीं,
Can I try it again? Stop this.
ऑप्शन में स्लाइड शो में जाकर क्लिक कीजिए सर, फ्रॉम द बिगिनिंग, फिर वो हो जाएगा।
ये from the beginning किया है Daksha.
अब ये फर्स्ट वाला आ गया।
सर
Okay,
ऊपर में
I'll stop
अब
it
गायब हो गया।
and then I'll
तो अब
present
फिर से
it
स्टार्ट करते हैं।
again.
और एक रिक्वेस्ट ये भी आ रही है सबसे, जब जैसे स्लाइड शुरू हो जाएं तो सर हमें डेफिनेशन बता दें, क्लाइमेटोलॉजी,
जी
मीटियोरोलॉजी
Daksha, sure.
अंतर है कि नहीं। और फिर हम लफ्ज इस्तेमाल करते हैं क्लाइमेट चेंज एंड ग्लोबल वार्मिंग, दोनों सेम
जी.
चीज है या ग्लोबल वार्मिंग हिस्सा है
Okay,
क्लाइमेट?
but it's not there, but I would include that in my topic. Share screen, share the entire screen, Dr. Faraj?
एंटायर स्क्रीन, हाँ जी।
Entire screen.
यस सर।
And is it visible now?
यस सर, इट
perfect,
इज ऑन
super
Okay,
perfect.
thank you. And good evening again. I'm Bhan. I was with India Meteorological Department till about a month ago. I superannuated on 31st of March. Still maintaining these affiliations because I have been associated with the department for last 34 years exactly. So it's a long association with a single organization. And so we will discuss today a bit of the climatology trends, what are the impacts of heat wave, and how is the management system, how did it evolve in the country. क्लाइमेटोलॉजी पे आएंगे डॉक्टर साहब, इसी से शुरू करते हैं। क्लाइमेटोलॉजी इज नथिंग बट averages. Average of any meteorological parameter is called climatology. If you average out temperatures over a period, that becomes climatology of that. So difference can be understood with climate and weather. Climate of nowadays, say for example, or most parts of the country is hot, let's say end of April and May. But a particular day in April could be very pleasant. If it has rained, good breeze is blowing, that is weather. So difference between climate and weather is that climate meteorological parameters. Weather उस दिन का, उस वक्त का, उस समय पे क्या है, that is weather. So climatology is long term mean. और ट्रेंड क्या चल रहे हैं हीट वेव्स में, इम्पैक्ट क्या है, मैनेजमेंट सिस्टम क्या है, ये इस पे आएंगे। सो किसी भी चीज को अगर स्टडी करें तो उसके पहले हमको उसको डिफाइन करना पड़ता है। एंड फॉर्चुनेटली और अनफॉर्चुनेटली हीट वेव का कोई यूनिवर्सल डेफिनेशन नहीं है। Normally, a prolonged period of excessive heat is defined as heat wave. Different countries define it in different way. The UK Met Office calls an extended period of hot weather relative to the expected condition, which is the climatological conditions, को heat wave बोलता है। The World Meteorological Organization (WMO) says that when daily maximum temperatures exceed the average maximum temperature by 5 degrees Celsius or more for 5 consecutive days, उसको heat wave define करते हैं. Bureau of Meteorology, that is Australian Met Agency, that says 3 or more days of unusually high maximum temperature and minimum temperature in any area. Likewise, many countries have their own definitions. And this level of heat discomfort is not just a function of meteorology, temperature. It is a combination of many meteorological parameters, particularly relative humidity and wind combined with temperature. Also, the socio-economic factors that include how are we clothed, what is our occupation, what is the accommodation we are living in, the habitation, what are the vulnerabilities, and also the physiological factors of an individual, that is fitness, health, age, level of acclimatization, all those things. The impacts depend on many combination of many parameters. And here in India, we have a definition of heat wave. It's based on two criteria. One is its deviation from normal. Say for if normal is nothing but again a long-term average. Say if today's temperature, normal temperature is 37, average temperature for 29th of April is 37 degrees Celsius. If the actual temperature of 29th April 2024 is more than that temperature by 4.5 degrees Celsius to 6.4 degrees Celsius, उसको हम हीट वेव बोलते हैं. और वो उससे 6.4 डिग्री सेल्सियस से ज्यादा प्लस में है तो उसको सीवियर हीट वेव बोलते हैं. इसके साथ ही अगर टेम्परेचर 45 डिग्री सेल्सियस हो जाए इरेस्पेक्टिव ऑफ डिपार्चर कितना भी है, इवन 2 डिग्री डिपार्चर है तब भी उसको हीट वेव बोलेंगे. और 47 हो जाएगा तो उसको सीवियर हीट वेव बोलेंगे. और कोस्टल एरिया के लिए सीवियर हीट वेव का क्राइटेरिया नहीं है क्योंकि नॉर्मली होती नहीं है. तो 4.5 degree Celsius is called a heat wave for coastal area. But there is a condition attached. These deviations plus in the plains, the actual temperature should actually reach 40 degrees Celsius, 30 degrees Celsius in the hilly regions, and 37 degrees Celsius in the coastal areas. Then only heat wave, it's defined as heat wave. Otherwise, no. A 35 degrees Celsius temperature in Bathinda may be above normal by 6 degrees Celsius, but we don't define it as heat wave. This is agreed definition, not a perfect one. This has got its own lacunae. We'll come to that a bit later. And then what causes the heat wave? Number one, the seasonality. The seasonal variation of temperature as the sun moves north and south of the equator, that causes warming in temperatures and heat wave. Then climate change plays its own role. Plus the third factor which contributes the urban heat islands. We'll come to all these factors one by one. Coming to seasonality, so this is the annual march of mean temperature over the country as a whole. This is averaged over the country. Individual days, the values would be different. So if we see the pre-monsoon days, so before onset of the monsoon, that's the warmest part of the year. Sun is directly over the country. Normally rainfall activity is not there, clear sky, high radiation. That leads to rise in temperature. And within that period, certain days qualify to be called as heat waves. So one is seasonality, when heat waves occur. Other is seasonality plus, and these are the average temperatures. Heat wave starts building somewhere over central and south central parts of the country. This is the April average maximum temperature. May is the warmest month for the country as a whole. And in June, with onset of monsoon, the southern parts start cooling, but northern parts still remain very hot. And let's mind it, this is average picture for June. Whenever the monsoon gets delayed, the heat wave can extend to other parts of the country also, in case monsoon onset is delayed over those parts of the country. And if you see the historical temperatures in different places, almost all places in major parts of the country have experienced very high temperatures ranging 46 to 47 degrees Celsius. And the record is held by a verified highest temperature is of Phalodi. This is a place close to Jodhpur. 51 degrees Celsius was recorded on 19th May 2016. So that holds the record for the country. And these are the temperature, let's mind it, that's temperatures measured in shade. ये धूप के टेम्परेचर नहीं है, छाया में जो टेम्परेचर मेजर करते हैं ये वो है सर. So the in fact temperatures of the air. And then comes the second factor, which is climate change. Before discussing it, let's come to climate change and global warming. Global warming is a phenomena defining persistent increase in temperatures across the globe because of the increased concentration of greenhouse gases. The greenhouse gases are the carbon dioxide, methane, oxides of nitrogen, and sulfate. Primarily these. Though water vapor is also categorized as a greenhouse gas, but its variation is so large that it is not taken into consideration. Ozone close to surface is a greenhouse gas, but ozone at higher levels at about 30, 35 kilometers, that leads to a bit of cooling. Uh, a greenhouse gas, in fact, kya hai? They are transparent to incoming solar radiation. So they allow the solar radiation to come to the earth. But when the earth emits back the radiation, these greenhouse gases are opaque to those radiations. So that heat emitted back by the earth into atmosphere remains trapped in the atmosphere. So with increasing in concentration of greenhouse gases, the temperatures are slowly rising. This is example of India, where mean temperature, this is deviation of mean temperature from average. If you see all the years from 1901 onwards till about 70s, all the temperatures were below average, and after that they slowly rising somewhere, some year or the other. But after in this century, if you see, all the years have been above normal. So this persistent increase in temperature, and this is happening across the globe. Our value is 0.66 degrees Celsius per 100 years, is slightly lower than global average. Global average stands about 0.76 degrees Celsius per 100 years. Because some of the colder areas are warming at much faster rates in higher latitudes. That's North Europe, Northern America, and something in Southern Hemisphere also. Tropics are warming at relatively slower rates, but that is no reason for us not to be careful because we are already very hot. So this is another reason for increased incidences because average temperatures are increasing. So individual days within those higher temperatures qualify to be heat wave, leading to more incidences of heat wave. एक ही एग्जांपल है, ये 29 अप्रैल के 1901 से लेकर 2022 तक के एक स्टेशन के टेम्परेचर्स हैं. And if you put the threshold of heat wave at 37 degrees Celsius, say for example in this case, because this is April, stations may be not so warm. If you see the beginning of the century, only during 1 or 2 years after every 5-10 years, कोई साल होते थे जो हीट वेव को क्वालिफाई करते थे, इस थ्रेशोल्ड को एक्सीड करते थे. फिर इनका इंसिडेंस बढ़ा, ज्यादा नंबर ऑफ डेज इस टेम्परेचर के ऊपर होने लग गए. एंड इफ यू सी हियर particularly this century 1990s onwards, particularly almost every year we get in heat wave day on 29th April. So that is climate change. So that superimposed over seasonality leads to more incidence of heat waves. And also the extreme average temperatures though are rising at this not such a high rate, 0.66 degrees Celsius in 100 years. But incidence of extremes is rising at a much faster rate. These are the trends of last 1951 to 2015 of the warm night having temperature above 90th percentile, so means 10% warmest nights and 10% warmest days on the right hand side if you see here. So they are constantly rising. And this increase is accelerated during last about 30 years or so. पूरे पीरियड का अगर हम देखें तो जो 10% वार्मेस्ट नाइट थी वो 3 नाइट्स पर डिकेड के हिसाब से इंक्रीज हो रही थी, लेकिन पिछले 30 साल में 7.7 नाइट्स पर डिकेड रेट से इंक्रीज हो रही. सेम फॉर वार्म डे टेम्परेचर. सो एक्सट्रीम आर राइजिंग मोर देन द एवरेज टेम्परेचर्स, अगेन लीडिंग टू मोर इंसिडेंस ऑफ हीट वेव्स. And then comes the urban heat islands, which it's superimposed over these natural phenomena. Urban heat islands are okay, I'll remove it. It's a phenomena. Okay, put it somewhere here. Okay. Where the urban areas experience warmer temperatures than nearby rural areas. On the top right hand side, if you see, this is thermal image of 5th of May 2022. these reddish shades and yellowish shades are warmer temperature and blue shades are colder temperature. इधर अगर आप देखेंगे तो राइट बॉटम कॉर्नर में दिल्ली है, which is warm. We can clearly see Jamuna flowing through it, जो cool है. And these are the cities, जैसे रोहतक, सोनीपत, पानीपत, जींद, भिवानी. So cities, and these may be larger villages or towns somewhere in between. So this is a phenomena called heat islands. Urban areas में ज्यादा टेम्परेचर का आइलैंड बन जाते हैं, दैट इज कॉल्ड हीट आइलैंड. एंड आल्सो विद इन सिटीज सर्टेन एरियाज कुड बी वार्मर. दिस इज ए वन डे टेम्परेचर थर्मल इमेज ऑफ दिल्ली. So certain areas are certainly warmer than other areas, indicating that within city also there are more intense urban heat islands. And this difference in temperature arises how the urban surfaces and also the rural surfaces they deal with the incident heat, how much of it they absorb, how much of they reflect it back, and then how much of it they emit, because every body which absorbs the radiation also emits it back, a part of it. And to clearly understand the difference, this is a New York City. This is vegetation map on the left hand side. These greens are the thicker vegetation areas, and this is a thermal image of temperature, surface temperature. The dark shades are lighter temperature, and the lighter shades are warm temperature. If you see, this is a green belt stretching this way. Here also temperature, lower temperature belts are there. This is a more green area, so cooler temperature. So those are the urban heat islands. They exacerbate the impact of heat waves within the cities. So primarily these three regions, जिनकी वजह से हमको ज्यादा हीट वेव के इंसिडेंस हो रहे हैं. And this is as I told, a resultant of radiation balance, heat balance. The urban construction material, they reflect less and absorb more of the incident radiation of the heat. Vegetation is also less, so evaporation cooling is also not there in the cities compared to the urban rural settings. Then there are multiple reflections of radiation downwards from the tall buildings, which leads to more radiation or more heat being, emitted, being reflected down into the cities. And these tall buildings and narrow streets, they reduce the wind flow and keeping the heat trapped. Then there is waste heat from air conditioners and also from the traffic, which adds to the phenomena of heat waves. So our situation is not different. This right hand side, we have a state of Patna, and on the left hand side, this is the state of Hong Kong. So everywhere the phenomena in larger cities is being realized. And all these factors are put together as leading to increased incidence of heat waves across the globe. It's not just India. These are some of the news. And if you see the historical incidences of heat waves, they have been occurring. It's not that it's a recent phenomenon. Heat wave had been occurring earlier also. But the difference is that now they are occurring more frequently. They are occurring over newer areas where there used not to be any incidences, and also they are longer, more intense. So these are the list, and if you see the darker colors, 1995 Chicago heat wave led to 780 deaths in a single city of Chicago. 2003 is famous heat wave of Europe, where around 30,000 people died, 15,000 alone in France. And 2010 July heat wave in Eastern Europe and Russia killed more than 55,000 people, of them around 25 in Moscow itself. And 2015 Karachi experienced severe heat wave. Unfortunately, it coincided with the holy month of Ramadan. People were not even drinking water, so that added to the casualties in Karachi and also in some other parts of the Sindh, which were very hot. And not to forget, 2021 temperatures in northwest Canada reaching 49 degrees Celsius, where 600 people died, and another couple of hundred in adjoining the United States. So such a cold settings also get heat waves. And these 4 years, 1995, 2003, 2010, and 15, are the landmark years as far as actions on heat wave are concerned. 95 Chicago heat waves led to a heat wave action plan in the United States. 2003 led to coordinated heat wave action plans in Europe, and particularly France had a very successful heat wave action plans after that. They were able to reduce mortality. We will come to that. In 2010 and 15, they are landmark years for India. We will come to that a bit later. And in the country, these are the number of heat wave days every year. They are constantly increasing. These are 1960 to 2020. And in last 60 years, incidence of heat waves per station have nearly doubled. Around 3 heat waves per station. This average for 100 stations in the core heat zone of the country. Now, on an average, we get around 6 heat wave days per year. And also the projections say that they would increase further. The climate projections into future and newer areas are being impacted. These are the heat wave areas in 1960s, decadal from 60s onwards. If we see the pre-60s and 70s, and if we take the first decade of this century, area under heat wave has increased, and also the intensity, more area falling under these darker shades. So more areas are experiencing heat waves are becoming severe. And also if we see in right hand side, this is March 2022, as many as 9 of 36 meteorological subdivision, 23 of them heat wave impacted. So around 40% of the area of the country was under heat wave in the month of March itself, and also in the beginning of April. So heat waves are coming to newer areas, they are coming early, becoming more severe. And coming to the impacts, health, we all medical persons, direct impacts हैं heat wave के heat related illness की forms में briefly उनको हम आएंगे. Indirect impacts बहुत है. Loss of livelihood. A rickshaw puller probably cannot go out in hot weather. A hawker cannot go to his work due to very hot weather. And also if they fall sick, and if any other family member falls sick, there are increased cost of medical aspects. Cost of living also increases because every family, depending on the resources available to them, are putting additional expenditure on space cooling and other household consumptions to mitigate impact of the heat waves. Lot of jobs are lost, industrial productivities go down, heat island impacts are increasing, which further exacerbate the heat waves. Droughts and wildfires are flared up by heat waves. Agriculture productivity is impacted. Energy consumption goes up tremendously. Tourism and transport are impacted. Water sector, of course, is impacted adversely. And coming to the direct impacts of heat waves in the form of heat-related illnesses, are the heat rash, which all of you know. मैं बहुत डिटेल में नहीं जाऊंगा. A cluster of red bumps or skins, not a very severe symptom. It can be cured easily if you clean the skin frequently, apply some coolant, that should help. Heat cramps are muscle spasm or pain, which prolonged exposure and exercise leads to heat spasm. Heat exhaustion is next, where from the severity of heat illness starts, which needs medical attention, or heat exhaustion leads to heavy sweating, loss of fluid, and also loss of salts, leads to weakness, nausea, vomiting, headache, dizziness. And this, though initially can be cured wherever the patient is, but also needs subsequent medical attention, medical care, because if not cured in time, it can lead to heat stroke, which is a very severe form of heat-related illness, leads to very high body temperature in excess of 104 degree Fahrenheit, with possible fainting, confusion, seizures, and if not treated well in time, 90% cases leads to fatalities. Though if treated in time, it leads to only 10%. That is the statistics world over. If treated well in time, it can be treated, but if not taken care of well in time, it is fatal in many cases. And indirect heat impact, as Dr. Kalra told in the beginning, other underlying conditions are flared up, particularly the CVDs and renal conditions, and there are economic implications, as we told, in hospitalization, medical cases. And also the health facilities are stretched to their limits under hot weather seasons. More patients coming to hospital, not just for heat-related illnesses, for other associated illnesses, which gets flared up because of hot weather season. So there is increased load on healthcare facilities in the country. And impact on the economic aspects. This is the report of International Labor Organization of 2019. It's a 5-year-old report. They estimated that the global equivalent of full-time job lost in millions in 1995 because of heat waves was 35 million, which is projected to increase to 80 million, more than double in 2030. लगभग 8 करोड़ जॉब लॉस होंगी पर ईयर, और ग्लोबल जीडीपी का जो लॉस है 1995 का उनका एस्टिमेट था 200 बिलियन यूएस डॉलर, जो 2030 में बढ़ के संभावना है कि 2040 बिलियन यूएस डॉलर हो जाएगा. It's more than 2 trillion US dollar, which is more than economy of many countries put together. And the lower and middle income groups are likely to be impacted more. If you see the bottom panel, up to 4% or more than 4% of their GDP share is expected to be lost because of heat waves. And the heat island impact, we already said, the impact of existing heat wave gets exacerbated because in a heat island, the nights also don't cool. In rural areas, though day may be equally hot, but the nights get cooled there. But in thickly populated, densely habited urban settings, the nights also do not cool. So the heat load remains on the body all through the day, 24 hours. And this is particularly severe in poorly ventilated habitats, densely populated areas and slums, and the vulnerable population, the old, children, pregnant and lactating women, those having underlying conditions, they are impacted more. Cost of energy, of course, goes up because we use electricity for indoor cooling and pumping of more water, and which has got a positive feedback. That also aspect has to be taken into consideration, because some power plants somewhere would be emitting greenhouse gas for that energy, which further adds to the greenhouse gases and warming of the atmosphere. Air pollutants also tend to concentrate in urban heat islands, particularly ground ozone, which is a toxic gas and also is a greenhouse gas. And we'll not go into detail. The wildfire and droughts, they get exacerbated because of heat waves. There's increased competition of water, early onset of heat waves leads to early onset of fire season. And it's not just our forest fires, it's agriculture and urban fires also increase in hot weather. In agriculture, it leads to decrease in agriculture productivity of farm crops, of livestock, poultry, because the livestock and poultry, they reduce their feeds to control the metabolism so that they generate less heat, and that leads to less growth of the livestock and poultry. And agriculture productivity, I'll give just one example, and agriculture insurance cost and premiums are also increasing. This is an example of Punjab, where the institute is located. This is year by year yield of wheat per hectare, that is in tons per hectare. If you see 2021, we don't go back into history, it has reached a high of about 5.2 tons per hectare in somewhere in 2018 perhaps, and 2021 it came down to 4.2 tons per hectare. And though it increased a bit in 2022, but it could not reach to previously attained levels. And the reasons are here in the bottom. If you see the month of February and 2021, this was very warm February over northwestern parts of the country. March was also warm, not to that extent. And in 2022, February though was not that warm, March was warm. And it also depends on at what stage of the crop the warm temperatures. अगर ग्रेन फिलिंग स्टेज पर टेम्परेचर ज्यादा होते हैं, क्रॉप का राइपनिंग जल्दी हो जाता है, it gets less time to accumulate the photosynthesis, leading to less seeds. So it is increasing the impact on agriculture in terms of quality of the produce, quantity of the produce, and eventually leads to food security and nutritional aspects, which may have additional health implications. Energy consumption goes up. This is daily energy and temperature, mean temperature for Delhi. This is old data, 2015 or so, about 10 years old. So at 20 degrees Celsius, 18 degrees mean temperature, the consumption was during those times was about 2000 megawatts per day. And at increased temperature of 40 degrees Celsius, the consumption rose to nearly double. So for every degree Celsius increase, in temperature, there is 100 megawatt increase in demand for electricity. Fire incidences, outages increase, water quality issues arise because of overuse, less water, cost of living increases. And coming to the heat wave management system in India, if you see here, this is in the insert is the old graph number of heat wave days. I have masked this portion. This is from 1992 onwards. If you see, हीट वेव बढ़ रहे हैं लगातार ओवर ए पीरियड हर साल, और ये डेथ है हर साल के हीट वेव से एसोसिएटेड. ये 2 साल 95 और 98 एक बार ओड नंबर छोड़ दें तो कांस्टेंट इंक्रीज है नंबर ऑफ हीट वेव डेज में, नंबर ऑफ पीपल डाइंग एवरी ईयर. And within that, there were 2 years, 2010 and 2015, which are landmark years in terms of heat wave management in the country. We'll come to that, what happened during those years. Though attempts should have started much earlier, maybe 95 or 98, but we woke up a bit later. The country woke up a bit later, let's put it that way. But still, not very late. What happened in 2010 was, though the number of the country, people dying in the country is not very high, what happened in Ahmedabad is that a large number of people died in the month of May due to heat waves. And the public health personnel there in Ahmedabad, led by the Indian Institute of Public Health, Gandhinagar, in association with Ahmedabad Municipal Corporation and one international NGO, IRDC, they analyzed the data of Ahmedabad city. अगर इसमें अगर आप देखेंगे, ये जो वर्टिकल बार हैं, ये एवरेज ऑल कॉज मोर्टेलिटी है अहमदाबाद सिटी की, एवरेज फॉर 2008, 9, 11 एंड 12. 10 को छोड़ दिया बीच में एवरेज करने के लिए. लगभग हर दिन 100 लोग मरते हैं सिटी में. इट्स बिग सिटी, 100 पीपल डाइंग इज नॉट वेरी अनयूजुअल. और तापमान अगर देखें, ये जो ब्लू लाइन है, दिस इज डेली टेम्परेचर, hovering around 40-42 डिग्री सेल्सियस इन सब दिनों का. What happened in 2010 was this. This is temperature, relatively higher temperature का scale इस तरफ देखना पड़ेगा आपको. Mostly above 42 degrees Celsius in most of the days, and accordingly the number of people dying was also slightly higher up to here. But something very significant increase in number of deaths happened from 19th May onwards. 19, 20 और 21 मई को 310 डेथ हुई सिटी में. This is roughly 3 times the average number of deaths. Temperature भी more than 46.7 degrees Celsius पहुंचा. So this high temperature led to abnormal number of deaths in the city. और अहमदाबाद म्युनिसिपल कॉर्पोरेशन और IIPH गांधीनगर का एस्टिमेट है कि उस एक वीक में 19 से लेकर 25 तारीख तक अहमदाबाद सिटी में 800 एक्सेस डेथ हुआ. और पूरा मंथ का अगर देखें तो लगभग 1350 एक्सेस डेथ उन्होंने कैलकुलेट किया कि बिकॉज ऑफ हॉट वेदर. सो दिस वाज द बिगिनिंग ऑफ हीट वेव एक्शन प्लान इन द कंट्री. और अगर देखें तो emergency calls for all symptoms were very high during that period. Emergency call for unconsciousness were also high. That's how the heat hot, and they look for all. कोई पेंडेमिक नहीं था उस वक्त, कोई मेजर एक्सीडेंट नहीं हुआ था सिटी में, कोई फायर इंसिडेंट्स नहीं हुआ था. तो all those deaths were contributed by heat wave. They might not have been direct impact of heat wave. These are all cause mortality. They are not cause specific mortality. So based on that analysis, the Ahmedabad Municipal Corporation, in association with Indian Institute of Public Health and NRDC, they put a first action plan in the country. They simply plotted daily all-cause mortality in the city against the maximum temperature of the day, and they found that at temperature at about 40.5 degrees Celsius, number of deaths start increasing. And there is sharp increase after 43 and very sharp increase after 45 degrees Celsius. So they assigned these 3 levels and told the meteorological department that whenever temperature is expected to be 41 degrees Celsius, आप हमें बताइए येलो कलर कोड में कि माइल्ड हीट वेव होने वाला है. 43 to 45 ब्राउन कलर में आप बताइए हमको कि दिस इज गोइंग टू बी मॉडरेट हीट वेव. एंड व्हेन टेम्परेचर्स आर एक्सपेक्टेड टू बी 45 degrees Celsius or more, give us a red heat warning. So they assigned the severity levels to daily maximum temperature based on their relationship with all cause mortality. So mortality based thresholds were compound, and their heat wave thresholds were based on mortality, not on the earlier definition, which I told in the beginning, that temperature should exceed this much and 4.5 or 6 degrees Celsius. No, they told give us these warnings based on these temperatures, irrespective of their departures. Or and then a heat wave action plan is not just weather warning. It had basically four components. One was the meteorology plus other agencies, that's early warning system and interagency coordination to alert the civic authorities, health officials, hospitals, emergency responders, and local community media outlets of the forecast temperature. That was one part of the heat action plan. It also involved people in a large way through public awareness program and community outreach to communicate the risk of heat waves and also the implementation practices to avoid the heat-related deaths and illnesses. Civic preparedness was done in terms of promoting adaptive measures. They opened parks used to get closed at 10 o'clock. So all the municipal parks were thrown open so that people can go there and have rest during peak hours of the day. Potable water was made available at different places in the country. Cool roofs initiative was started. And another, and probably among the most important part, was the capacity building among the healthcare professionals so that they recognize and respond to the heat-related illnesses, to manage them with the aim to reduce mortality, and strengthening with healthcare system was strengthened. Heat wave wards were put in place, cooling packs were kept ready in hospitals, medicine, IVs, ORS, etc. The hospital system was strengthened. So these are prime parts of the heat action plan. It's not just the weather forecast. So all other aspects were taken into consideration. And then came 2015, where more than 2,000 people died in the heat wave. That brought the national agencies together, led by the National Disaster Management Authority, who came out with the first guidelines for preparation of heat action plans in 2016, and which were further revised. Two more revisions are there. Now 23 states and 150 districts or cities have their own heat action plans. These are detailed documents starting from weather forecast, how to get it, where to get it, whom to send it, how different civic systems are to be prepared, starting from schools, if timings are to be changed, if breaks are to be given to construction and other outdoor workers, how cooling centers would operate in different cities, manage provision for drinking water. These are the guidelines, latest of 1919. This is heat action plans Odisha. And one district in your neighborhood has a heat action plan, that is Firozpur. And this is city heat wave action plan, Bhubaneswar city. And I'm not sure, Dr. Kalra, of any action plan of the medical institute. Maybe AIMS, Batinda can be the first one in the country to start their own heat action plans. And then Ministry of Health and Family Welfare also took the lead. They launched the National Plan on Climate Change and Human Health as a part of National Health Mission with the aim to reduce mortality, morbidity, and vulnerability of the towards heat, with broad components of awareness generation, capacity building, strengthening of a health system, collaborative partnership, and research. These are the five key components of this National Plan on Climate Change and Human Health. And also in year 2021, they launched the National Action Plan on Heat-related Illnesses. This provides guidelines on what would be the impacts of heat on health, how to clinically manage the HRIs, how to prepare the health facilities. A surveillance system was put into place, which has started working now, though not perfectly. We'll come to those data in a while. And the main component, the vulnerability-based actions, roles and responsibility of health officers were defined. District or local level health actions were planned, and long-term adaptation and mitigation actions were also outlined. And last year, they came out with a very pertinent focus document on emergency cooling and for severe heat-related illnesses, with specific focus on how to cool various body parts with various methods. It could be evaporative cooling, it could be immersive cooling, and in what case, what technique is to be put in place. And the ministry recommends to incorporate these into emergency healthcare systems across the country. And the abridged version of that was also launched last year itself, a strengthening of health system for HRIs in India. So this provide guidance on facility preparedness to manage HRIs, standard operating procedures for hospitals, including the community health center and district hospitals, and also during ambulance transport, and setting up of heat stock rooms in healthcare facilities and also in ambulances. So these are important documents are being adopted progressively by many health sector organizations. And also the component, then India Meteorological Department also was roped in. Though we had been issuing the forecast for heat wave earlier also, uh, but they were not so systematic. Now we have a system where we start with seasonal outlook, which are issued twice in the season. One is end of February for March, April, and May. One is end of March with April, May, and June. And it looks like this. So that provides outlook in the season, how many heat wave days would be there over different parts of the country. So this is for the season as a whole, and this is for the month of April, where these are the outlooks, what could be the possible. And then there is an extended range forecast system. We provide outlooks for next 4 weeks. This is current outlook starting from 8th March. This has become a bit old. So we are somewhere here now. So the coastal areas were predicted to be more warmer, which is happening that way. And these two forecasts, the extended and seasonal, are in terms of anomalies, how it would be different from averages. But when it actually comes to the part, we provided a heat wave guidance with quantitative temperatures for district and city scales for next 5 days with color coded warnings. So a daily bulletin is issued, which has observations for past 24 hours, what are the areas under heat waves, and forecast for temperature and heat index for next 5 days. And similar warnings in color codes are also issued for all the districts across the country and for more than 1,000 cities. And this plan has been refined over the years. Now humidity is added to the information, heat index and wind is also included. And for the cities which have their threshold computed, we provide them threshold based early warning. And what has been the impact we come to? These are I'd stopped the earlier graph somewhere here in 2015. After that, this has been the trend in all cause heat-related mortalities across the country. It came down to nearly half in 2016. 2000 से ज्यादा लोग मरे थे 2015 में, 16 में घट के लगभग 1100, 17 में 300 कुछ, 18 में ओनली 4 डेथ हुआ था, 19 में अगेन ये बढ़े, 20, 21, 22 का डेटा प्रोडक्शन डाउटफुल है ड्यू टू कोविड, रिपोर्टिंग वाज नॉट देयर, लेकिन कंप्लेसेंट होने का जरूरत नहीं है. लास्ट ईयर अगेन मोर देन 300 पीपल डाइड बिकॉज ऑफ हीट वेव्स. But generally there has been a decreasing trend. If you see the bottom right corner, 2011 से 15 के 5 साल में लगभग 7,000 डेथ हुए और 2016 से 20 के दौरान लगभग 1,800 डेथ हुई. So this is a well coordinated, successful system for heat wave management in the country. This is reporting of heat related illnesses, total heat stroke cases and total OPDs by month. Different states are reporting to the National Center for Disease Control. So real-time reporting has also started. That gives an idea to the managers that if abnormal cases are arising in some areas, attention can be focused to those areas. Then there are some issues to be discussed, addressed. One is temperature thresholds. The heat wave, if you see, the warnings were based on only departure of temperatures from the averages. In most of the cases, they were not based on relationship between temperature and mortality or morbidity. Therefore, we need more evidence-based thresholds to provide impact-based forecasting. And we are IMD is collaborating with many cities who desire to establish their thresholds. And thresholds could be different for different cities. This is Ahmedabad graph we see where mortality start increasing after 40 degrees Celsius. This is for Shanghai, where the mortality start increasing at about 33, 34 degrees Celsius. Shanghai being a coastal station, humidity plays a role. So every city need to have its own thresholds. Awareness has to be increased in the community. Pre-season engagement, mid-season engagement for impact-based early warning, where the forecast would be available, how to act upon that, those forecasts, how to get the assistance from, and then post-season feedback and interaction with the users for further refinement. analysis of vulnerability among different vulnerable groups have to be carried out so that targeted products can be prepared for those groups. And then we also need to teach the general public to identify HRI simple. I got a very pertinent graph on the right hand side, this urine color chart. If this can be pasted at prominent places, maybe in public toilets, urinals, in the schools, hospitals, from color of your urine, you can identify that if you are well hydrated or you are dehydrated, so that you can recoup your water. Community education, awareness, identification of the processes that has to be done. And then we need to know the heat related symptoms, starting from heat stress, heat cramps, maybe heat syncope also, then more severe form of heat exhaustion and heat stroke. So what are the symptoms associated with them? What to how to identify and what to do in each cases? Maybe that awareness need to be increased so that initial care can be provided on the spot itself, because some of the incidences are life threatening. So publicity material has to be prepared, distributed among the public, made it aware over the season through maybe repeated awareness campaigns. And this I will not go. You all know what are the symptoms and how to manage. This is a graphics I taken from the United States. It's a very simple. What are the signs of heat exhaustion? What are the signs of heat stroke? And what to do in what case? In case of heat exhaustion, move to a cooler place, cool with ice or cold water, drink cold water, and call 911. This is their emergency number if the symptoms last longer for 1 hour. And in case of heat stroke, this is emergency, call for help immediately, move the person, immerse it in cold water, maybe ice if possible. So that kind of simple graphics can be generated. We also do it. The national NDMA and NCDC has come out with very useful infographics for increasing awareness. And then targeting of information. This information needs to be tailored for different user groups because the same information has to be worded, tailored in a different way for different users. For end user, it could be tailored differently, for a hospital management system in a different way, for municipal authorities in a different way. So that needs to be done, and that needs to be done in consultation with the users. Local authorities, municipal corporations and councils in terms of supply of water, electricity, break in construction, work during the daytime, opening of cooling centers, schools, and special arrangements for vendor hawkers need to be put by them. The medical hospitals and medical professionals, they need to be involved. NGOs for capacity building. This is very good attempt done this year by an NGO, Mahila Housing Trust in Jodhpur. This is they put an integrated cooling center which can house about 40 people at a time. This integrated system with sprinkles water on the cooling curtains to make it cool. This is solar powered, so therefore sustainable. Wind power is utilized to airflow to expel the hot air. There's provision for cooling water in the center, and also there is a counselor to counsel the persons who come here. That kind of initiatives can be taken so that the HRIs can be minimized. And also we need to co-produce the information on heat wave, the bulletins on heat wave needs to be designed sitting with the meteorological agency, the health professionals, and the end users together, so that it can be designed in a way which is well understood by all the stakeholders. And also, if it is required to be differently designed by different stakeholders, different products can be designed. Then it can emanate out of any source. Then warning dissemination. People need to know how and where to get the warning from, what are the mechanism, and maybe warning dissemination medium also needs to be user friendly. All do not have access to internet or WhatsApp. For them, a different mode of communication has to be designed. And this is a graphics I use. It is probably we are coming. This is not related to heat wave. I love this graphics. This is 2017 perhaps. There was a forecast of thunderstorm, hailstorm, and lightning in Marathwada region of Maharashtra. and there the agriculture department issued, if any of you can read, अगर नहीं पढ़ सकते तो मुझे थोड़ा सा मराठी आता है, मैं 4 साल तक से बम्बई रहा, तो वो इन्होंने ये बोला जो अपना खेती का सामान है उसको सुरक्षित ठिकाने पर रखिए, और जो मार्केट में आपका कोई सामान अगर पड़ा है उसको आप ढक के रखिए, सिक्योर कर लीजिए। अगर बिजली कहीं आपको आसपास चमक रही है तो आप सुरक्षित जगह पर आइए। कोई अकेले पेड़ है और खुले मैदान में नहीं खड़ा हुई, दिस इज ए रिकमेंडेशन इन केस ऑफ लाइटनिंग। एक सिंगल पेड़ के नीचे डक सब नहीं खड़ा होना है हमको, और मार्केट में कोई ले जा रहे हैं उसको जल्दी पहुंचाइए। और ये पर्टिकुलर जिले हैं जिनमें ज्यादा हो सकता है। इट्स वेरी गुड इन्फोग्राफिक्स इन लोकल लैंग्वेज, इजी टू अंडरस्टैंड, so that kind of graphics can be generated. And perhaps this is the last slide. So for any early warning system we need to know the risk. So risk analysis has to be done for every places. How is the incidence of heat wave in this case, vulnerability क्या है, क्या हमें known है, pattern उनका क्या है, क्या उनका mapping किया है, monitoring, real time monitoring and heat warning system needs to be put in place, क्या सारे पैरामीटर मॉनिटर हो रहे हैं, वार्निंग टाइमली और एक्यूरेट हैं क्या, then response capabilities of the intermediate responders and the end responders, which is a hospital care system, are they well enabled, well capable, well aware, and dissemination and community preparedness. ये 4 component है, ये चारों to some extent have been taken care of in heat wave action plan, but still not perfect. We need to work together, and all the stakeholders, particularly the medical community and disaster managers and the meteorological community, have to come together so that further impacts, which are going to increase, can be kept to the minimum. Thank you very much. Thank you. And these are some additional slides if you want to see. एक study किया मराठवाड़ा में, what are the symptoms in population, because vulnerability assessment के लिए जरूरी है. So these were the symptoms reported: headache, heavy sweating, fatigue, intense, and in some of the cases fainting and swelling of face was reported. और relative odd ratio compute किए, नॉन इनकम जनरेटिंग एक्टिविटी उन्होंने डिफाइन किया, जो इंडोर घर में रहते हैं वो, उसको रेफरेंस लिया. सो फार्मर्स वर एट 2 times more likely to be impacted, agriculture and non agricultural labor more than 3 times likely, and Manrega 3.7 times likely more impacted. So that brings out the vulnerability of those groups, so that special arrangements can be done for those. And again, this is vulnerability. लगभग 53% केसेस ने बोला कि हमें कोई इलनेस नहीं हुआ, माइल्ड इलनेस रिपोर्टेड बाय 42% and severe illness by 3.2. So both men and women suffered equally. Women slightly less in this study because they were more confined indoors than outdoors. We also did a study for Chandigarh where women were less, though impacted in absolute numbers, but increase in incidence of mortality in women was more with increase in temperatures. And coping strategy में आए तो the blue ones are always, ज्यादा पानी पीने की स्ट्रेटजी लोग हमेशा अपनाते हैं, लेकिन जिनमें बात कम लोगों ने यूज किया क्योंकि शायद पानी का शॉर्टेज है वहां पे. सनकोट, ऑफ कोर्स इट हैज गॉट इकोनॉमिक इंप्लीकेशंस, दे डिड नॉट यूज इट. एक्टिविटी रिड्यूस करना, इंडोर रहना, सम केसेस में दे इम्प्लाइड बिकॉज दैट हैज आल्सो गॉट इकोनॉमिक इंप्लीकेशंस. That, and this is a study of Ahmedabad city. Again, कौन से symptom done on outdoor workers. That was earlier was for Marathwada, for in a rural setting. This is an urban setting in Ahmedabad city. How the outdoor workers reported the different symptoms. I think. Okay, and what are the adaptation strategies? छाया में बैठना है, ज्यादा लिक्विड पीना है, बट जिनके फाइनेंशियल इंप्लीकेशंस हैं वो अडेप्टेशन मेजर लोगों ने कम ले पाए. ORS कम ने यूज किया. स्टे होम, प्रोबेबली दे वर आउटडोर वर्कर्स, दे कुड नॉट अफोर्ड इट. वेट नैपकिन रखने का नहीं था. फ्रूट प्रोबेबली खा नहीं सकते थे. आइसक्रीम शायद खा नहीं सकते, इसलिए यूज नहीं किया. दैट्स ऑल. थैंक यू वेरी मच डॉक्टर.
थैंक यू सर. बहुत ही
स्टॉप शेयरिंग.
डन, ऑलरेडी डन सर. थैंक यू सर. बहुत ही अच्छे से तरीके से पढ़ाया आपने. एंड अनामिका अनु जी, सरताज सिंह जी, सब आपको थैंक यू कर रहे हैं. एक गुड इवनिंग है सर अली नजाकत साहब से. और उजैर अनवर जी पूछ रहे हैं, he says sudden rise in temperature is linked with greater heat related incidents. both disease and death, like you've mentioned.
Yeah.
And he says you've already mentioned the proactive precautions, जैसे अहमदाबाद वालों ने की, आपने ये भी पॉइंट आउट किया कि मेडिकल कॉलेजेस को इसमें लीड लेनी चाहिए। बट वो पूछ रहे हैं, अनवर साहब पूछ रहे हैं, सर एट होम व्हाट कैन वी डू? मैं
At
घर पे
home,
रहता
what
हूँ,
we do accept it depends on what kind of home we are staying. Different strategy. Number one, first and foremost, all medical professions drink lot of liquid, maybe a bit of salt and sugar. Keep yourself well hydrated. That goes across the populations. Other is that if we have some cooling arrangement that should be implied, and if temperature goes beyond 40 to 43 degrees Celsius and in not so well ventilated places, the recommendation is that you use a floor fan and in a reverse mode so that it throws the hot air out of the your room or slum if you are staying in. Keep the roofs clean. A clean roof initiative has been launched. I will share some of the resources with you in due course, Doctor, which you can further share with others. Uh,
right?
Painting the roof white helps to keep temperature below by 3 to 4 degrees Celsius. Reflective tiles on the roofs. And one example of Ahmedabad, जैसे मैं बताऊं जो 2010 में हुआ, उनका एनालिसिस में ये पाया, there were lot of neonatal casualties heat wave के दौरान। उसका एक कारण ये था डॉक्टर, जो न्यूनेटल वार्ड था, that was on top floor of the municipal hospital, which was significantly warmer than other wards. So one thing they did, next is they brought down the neonatal ward to some lower floors, और पूरा हॉस्पिटल की छत पर रिफ्लेक्टिव टाइल्स लगाए, so temperature they could control to certain extent. So the passive cooling have to be adopted, and if we have air conditioner, that is the alternative, but uske financial implication hai, that contributes to global warming and all those things are there. So keep well hydrated, wear light clothes, don't move out in the sun. If you at all you have to move out, keep water with you, maybe drink local drinks, lassi, nariyal pani, dal ka pani, torai. Carbonated drinks are to be avoided, except heavy foods, alcohol, these things are to be avoided. So keeping hydrated with some increased input of salts and supplement. Local drinks are good enough. Need not have any special drink. Patla lassi, nariyal pani, sikanji, nimbu ka. You need not go for very expensive drinks for keeping yourself hydrated. Cool roof, that could be a white paint on the roof, so maybe reflective tiles helps to keep temperatures below by 3 to 4 degrees Celsius, which is a significant impact. खिड़की खुला रखना है रात को, आधी रात के बाद अगर एयर कंडीशनर नहीं है तो वी शुड कीप द विंडोज ओपन सो दैट द वेस्ट हीट इनसाइड इज फ्लश्ड आउट।
सो सर जो हमें पढ़ा रहे हैं, एक तो ये कि हाइड्रेशन, पानी का ख्याल रखें, एंड वी विल टेक मोहम्मद वासिफ सिद्दीकी साहब क्वेश्चन शॉर्टली, बट द चॉइस ऑफ बेवरेजेस इज आल्सो इम्पोर्टेंट। दूसरा, चॉइस ऑफ लाइफस्टाइल, आप कब निकलते हैं काम पे, धूप में जाते हैं कि नहीं, अगर आपने सैर करनी है, वर्जिश करनी है, तो गर्मी वाले घंटे ना चुने, अर्ली मॉर्निंग या लेट नाइट कर लें अपनी एक्सरसाइज जो भी करना चाहते हैं। चॉइस ऑफ क्लोथ्स, लाइट कलर्ड क्लोथ्स, लूज क्लोथ्स पहने। चॉइस ऑफ लाइफस्टाइल में ये भी आता है, जैसे सर ने कहा कि विंडोज खोल के रखें, और एक आर्किटेक्चर की सर ने बात की, आपकी छत कैसी है, कलर कैसा है पेंट का, इन सब चीजों का बहुत इम्पैक्ट पड़ता है। वील टॉक
एक
अबाउट
डॉक्टर मैं ऐड करूंगा जो सब कह रहे हैं डॉक्टर कालरा, उसमें जो मैनेजमेंट सिस्टम है डॉक्टर, बहुत सारे स्टेट जो हैं, दो स्कूल्स के लिए पर्टिकुलरली, बिकॉज चिल्ड्रन आर मोर वल्नरेबल, स्कूल टाइमिंग्स चेंज करते हैं, अर्ली टाइमिंग, एंड स्कूल्स आर ओवर बाय 12 o'clock, जो पीक दिन का तो उसके पहले बच्चे घर आ जाते हैं, दैट इज वन एस्पेक्ट। दूसरे, पिछले 3-4 साल से शुरू हुआ खासतौर पर केरला, कर्नाटका, तेलंगाना और कुछ स्कूल महाराष्ट्र में, दे हैव स्पेशल वाटर बेल। नॉर्मल बेल होता है पीरियड के बीच में, बच्चे अपना पानी पीते हैं कि नहीं है, हर दूसरे पीरियड के बीच में डॉक्टर साहब एक वाटर बेल होता है, जहां टीचर इंश्योर करता है कि सब बच्चे पानी पिए इवन इफ दे आर नॉट थर्स्टी। एक वाटर बेल बचता है डॉक्टर साहब, सो दैट बच्चे, क्योंकि खेल में हैं, बच्चे हैं, वो केयर नहीं करते, भूल जाते हैं, तो उनको पानी पिलाने के लिए एक स्पेशल बेल चलता है, नंबर 1। दूसरा जो आपने बताया कि पीक आवर्स में ना करें, द कंस्ट्रक्शन वर्क इज कंपल्सरली स्टॉप इन मेनी स्टेट्स फ्रॉम 1 to 4 PM। तो अर्ली कंस्ट्रक्शन वर्क शुरू होता है और मे बी लेट इवनिंग, ये 4 घंटे, एंड द कॉन्ट्रैक्टर हैं उनके लिए कंपलसरी है डॉक्टर साहब, वो कूल एरिया उनके रेस्ट करने के लिए प्रोवाइड करें, क्लीन ड्रिंकिंग वाटर का अरेंजमेंट वहां हो. So these have also led to significant reduction in HRIs among the outdoor and construction workers.
That's also important, and we should take care of our workers as well, people who work for us. विनायक शर्मा जी भी गुड इवनिंग कर रहे हैं. एक लास्ट क्वेश्चन लेते हैं सिद्दीकी साहब का. हीट वेव्स कैन ट्रिगर पैल्पिटेशंस और वेंट्रिकुलर एक्टोपिक्स, और उसका रीजन बताते हैं. हीट वेव के साथ एक तो फ्लूइड्स तो कम होते ही हैं, मगर इलेक्ट्रोलाइट्स में भी गड़बड़ हो जाती है. कभी कभी सोडियम पोटेशियम में गड़बड़ होती है. तो
imbalance
सोडियम
होता
का,
है.
हाँ, सोडियम कम हो गया, पोटेशियम ज्यादा हो गया. अब जैसे मिस्टर भानसर ने बात की अबाउट कंस्ट्रक्शन वर्कर्स, हम जहाँ काम करते हैं ये एग्रीकल्चरल बेल्ट है. सो व्हाट वी टेल आवर पेशेंट्स इज, आप देखो आप घर पे डंगर छोड़ के आए हैं, जानवर छोड़ के आए हैं, उनको अनलिमिटेड सॉल्ट दे के आए हैं. इन एनी विलेज इन पंजाब और हरियाणा और एनीवेयर इन द कंट्री, the animals, the cows and buffaloes get unlimited salt to eat. दैट इज बिकॉज द फार्मर नोज के सॉल्ट की कमी हो जाएगी. और काऊ और बफलो को भी पता है कि कितना नमक चाटना है, कितना नहीं चाटना. मगर वही फार्मर जब खुद खेत में जाते हैं, पैली पे जाते हैं, पानी तो वो पी लेते हैं ट्यूबवेल से, मगर सॉल्ट खाना भूल जाते हैं. एंड पानी जैसे पीते रहते हैं, दे एंड अप वर्सनिंग देयर हाइपोनेट्रीमिया. सो व्हाट वी टेल देम इज कि आप खुद और आपके वर्कर्स सब, द लीस्ट यू कैन डू इज कि आप नमक चाटते रहें हर 1-2 घंटे पे पानी के साथ. एंड if the best you want to do, that is also very economical, very cheap. 1-1 रुपए के जलजीरे के पैकेट आते हैं across India. So in North India you may wish to use जलजीरा, in West you may wish to use कोकम जूस. जैसे सर ने महाराष्ट्र और कोंकण की बात की, वहां का कोकम जूस बहुत स्वाद है.
कोकम बहुत चलता है.
हाँ, तो सॉल्टेड कोकम जूस पीते रहे हर 1-2 घंटे पे. यू विल फाइंड कि आपकी सेहत भी ठीक रहेगी, और जो वर्कर्स हैं फील्ड में, खेत खलिहान में, उनकी प्रोडक्टिविटी भी बेटर हो जाएगी. एंड दैट विल हेल्प प्रिवेंट द वेंट्रिकुलर एक्टोपिक्स आल्सो, जो सिद्दीकी साहब जिनकी बात कर रहे हैं.
यस, वो है. और दूसरा डॉक्टर, एक चीज और मैं ऐड कर दूं, हमको अपने परिवार में, स्कूल में, कम्युनिटी में मैसेज को फैलाना है, और सिम्टम्स को आइडेंटिफाई करने के हम कैपेबल होने चाहिए हर कोई. इफ देयर इज सम माय फैमिली मेंबर, मुझको अगर मैं आइडेंटिफाई कर सकूं हीट रिलेटेड इलनेस है इसको, उसको मेडिकल केयर या जो उसको इमीडिएट ऑन द स्पॉट केयर है, मैं उसको दे पाऊंगा. अदरवाइज व्हाट हैपेंस, वी स्टार्ट, you take it to a doctor in a CHC or maybe PHC or maybe private doctor in a rural area, वो फीवर के लिए ट्रीट करना शुरू कर देता जाती. तो नॉर्मल प्रोटोकॉल अभी ये जो है मिनिस्ट्री ऑफ हेल्थ का डैशबोर्ड, ये कहता है अगर हीट जैसे सिम्टम है तो इन्वेस्टिगेशन कैन गो पैरेलली, उसको आप चलाइए, लेकिन हीट रिलेटेड ट्रीटमेंट उसका आप इमीडिएटली शुरू कर दीजिए.
ये सबको कहेंगे, ये फर्स्ट एड जो है जिसकी मिस्टर भान साहब बात कर रहे हैं, ये बहुत इंपॉर्टेंट है. पानी पिलाएं, इलेक्ट्रोलाइट्स ठीक करें, ठंडक वाले इलाके में ले जाएं. सर, रिसेंटली आई लर्नड अ न्यू एक्रोनिम, वूका, VUCA. ये मैनेजरियल कम्युनिटी में, बिजनेस कम्युनिटी में ये ट्रेंडिंग एक्रोनिम है, क्योंकि वूका डिस्क्राइब्स आवर लाइफ टुडे. वूका स्टैंड्स फॉर वॉलेटिलिटी, अनसर्टेनिटी, कंप्लेक्सिटी एंड एम्बिग्विटी. और ये जो हीट वेव है, ये वॉलेटाइल भी है, अनसर्टन भी है, पता नहीं कब आएगी, कैसे आएगी, कॉम्प्लेक्स भी है. एक कारण नहीं, मल्टीपल कारण है. जैसे आप देखो अभी आपके छत पे टाइल्स कैसी हैं, आपके बच्चे या जो नर्सरी वाले बच्चे हैं वो छत पे हैं या बेसमेंट में हैं, दैट आल्सो मेक्स अ डिफरेंस. एंड एम्बिग्विटी, एवरीवन विल हैव अ डिफरेंट ओपिनियन. इवन जैसे सर ने बात की शुरू में, हीट वेव की डेफिनेशन भी एक शहर से दूसरे शहर में अलग है. सो भुवनेश्वर में अलग है और पटना में अलग है डेफिनेशन. सो दिस वोका वाला जो कॉन्सेप्ट है वो लागू होता है हेल्थ केयर पे हमेशा ही, और खासकर लागू होता है हीट वेव और हीट एसोसिएटेड इलनेसेस पे. मगर सर ने इस वोका को इतना आसान कर दिया, इतना सिंपल, इतना सरल कर दिया, इतना सेंसिबल और स्मार्ट वे में सर ने हमें पढ़ाया. इसके लिए सर बहुत बहुत शुक्रिया आपको, सबकी तरफ से बहुत बहुत थैंक यू करेंगे.
धन्यवाद डॉक्टर साहब, बहुत बहुत. और ये स्लो वो है डॉक्टर साहब, ये हीट वेव डू नॉट कम विद अ बैंग. थंडरस्टॉर्म होगा, फ्लड होगा, एकदम से आ जाएगा. धीरे धीरे आता है. आधे इंपैक्ट हमको होने के बाद पता चलते हैं कि इंपैक्ट हो गया. एंड इट स्लोली इंपैक्ट्स, इट विल, स्ट्रेस बिल्ड्स ओवर अ पीरियड.
सर हमारे साथ आज फराज हैं बैक स्टेज. सो फराज, व्हाट डिड यू लर्न टुडे फ्रॉम मिस्टर भान्स लेक्चर? फराज ने क्या सीखा पूछते हैं. फराज इज अ शाई बॉय सर, कभी कभी शर्मा जाता है.
नहीं, फराज इज वेरी एक्टिव. ही फैसिलिटेटेड मी इन द बिगिनिंग. फराज, you can, yeah, please.
Thank you so much, sir, for this opportunity. It is really glad to share stage once again.
तो सर आज का जो टॉपिक था वो काफ़ी इफेक्टिव टॉपिक है, जैसे कि हमारे कंट्री में सबसे ज़्यादा हीट और धूप का नज़ारा देखने को मिल रहा है, और उसको मैनेज कैसे किया जाए, उसका जो थ्योरेटिकल पार्ट है वो समझना काफ़ी इंपॉर्टेंट होता है। जैसे कोई भी प्रॉब्लम के सॉल्यूशन जानने के पहले उसको समझना पड़ता है कि क्रिएट कहाँ से हो रहा है। अगर उस चीज़ को हम लोग समझ जाएंगे तो अपने ऊपर में काफ़ी इफेक्टिवली इसके ऊपर काम करके सेफ रह सकते हैं हीट और हॉट वेदर से।
बिल्कुल फराज, आई एग्री। और इसका अच्छी बात यह है डॉक्टर साहब, हीट रिलेटेड मोर्टिलिटी मोर्बिडिटी है प्रिवेंटेबल है।
हम
अगर
सब
हम
प्रिवेंट।
केयर रखें तो वो प्रिवेंट की जा सकती है। पक्का नहीं, हीट में एक भी आदमी मरना जरूरी नहीं है, हम बचा सकते हैं हर जिंदगी को।
हमें सबको बचाना चाहिए, और बस ट्रिक ये है कि सब आपस में बात करें, एक दूसरे के साथ अपनी नॉलेज शेयर करें। जैसे मिस्टर भान सर ने अपना इल्म, अपना ज्ञान शेयर किया, ये भी कहूंगा कि एक्सपर्ट्स होने चाहिए। अब मिस्टर भान सर ने तालीम भी ली मीटरोलॉजी की, तालीम के अलावा तजुर्बा भी है, इतने सालों का, इतने दशकों का तजुर्बा। तजुर्बे के अलावा तरबियत, एक्चुअल एक्सपर्टीज, ही हैज वर्कड ऑन द ग्राउंड। ये नहीं कि सिर्फ थ्योरी वाला ज्ञान है, प्रैक्टिकल वाला है। तो
मैं तो डॉक्टर
अगर
साहब
हर
भटकता
एक
रहा
की
हूँ भाई। ट्रेनिंग आई एम एन एग्रीकल्चर मीटियोलॉजिस्ट।
हम्म,
ड्यूरिंग मोस्ट ऑफ माय करियर आई वर्कड एज ए ऑपरेशन वेदर फोरकास्ट में काम किया, एग्रीकल्चर मीटियोलॉजी में एंड में आके मैंने काम किया। ये हीट
तो
का जो था 2015 में जब शुरू हुआ, तो आई वाज एसोसिएटेड फ्रॉम द वेरी बिगिनिंग, डे वन से।
सो तालीम, तरबियत और तजुर्बा तीनों इकट्ठे, और चौथी चीज जो मिस्टर भान लाए आज स्टेज पे वो है तहजीब। इतने प्यार से उन्होंने हमें समझाया। सर आपको शुक्रिया, धन्यवाद, मेहरबानी, क्या बोले।
अच्छा, बहुत
बट
बहुत धन्यवाद, मुझे मौका दिया, मेरे लिए बहुत खुशी का बात है। और कभी ये दिल्ली आए कोई भी डॉक्टर साहब, आई रिक्वेस्ट दर्शन दें तो हमें बहुत खुशी होगी आपसे बात करके।
थैंक यू सर, सबकी तरफ से, के मेट टॉक परिवार की तरफ से बहुत बहुत शुक्रिया सर, वंस अगेन।
और,
थैंक
और
यू।
एक
एंड
लास्ट बात मैं ऐड करूंगा डॉक्टर साहब, इट्स वेरी गुड इन मेमोरी ऑफ डॉक्टर के। वो 2011 या 12 में हमने हेल्थ, मीटियोलॉजी एंड हेल्थ का, हीट वेव का नहीं, हेल्थ एंड वेदर का फर्स्ट लेक्चर डॉक्टर के अग्रवाल के मैंने करवाया था। आई पर्सनली कॉन्टेक्टेड हिम, कॉल टू आवर ऑफिस, he came. So it's good that in his memory I could speak today. Unfortunately, he is no
इम्पोर्टेंट,
longer with us. Corona took him away from us. So
बट उनकी
I'm
यादें,
really
उनकी
happy
इंस्पिरेशन
that
है।
I could pay homage to him also.
थैंक यू सर। एंड फराज, कुड यू प्लीज शो सर्टिफिकेट ऑफ एप्रिसिएशन फॉर मिस्टर भान सर। थैंक यू सो मच सर।
Thank you first. Thank you very much.
थैंक यू सर, बहुत बहुत
Thank you, sir.
शुक्रिया।
Thank you.
जय हिंद
Bye,
सर।
everyone. Bye. फिर मिलेंगे. Thank you.
सर
So I leave the studio now.